Atrial fibrillation is a very common condition, often undiagnosed. The problem is that it's a major risk factor for stroke, so it approximately triples your risk of stroke, even if you don't know about it.
I was asked if I had palpitations, no. All the other symptoms I didn't have. So I could have carried on oblivious.
I found out about it literally by going in routinely to collect my routine medication, my repeat prescription.
If you want to reduce the rate of AF-related stroke, you have to find all the patients who have atrial fibrillation. And if they don't have symptoms, the only way you can do that is by screening them, identifying them, and then treat them appropriately.
Firstly, we produced an eye-catching poster to advertise the service. So a patient would go to the local pharmacy, see the poster, and speak to their community pharmacist about whether they would be suitable for the service. The community pharmacist would look at their patient medication record system, or they could look at the repeat medication list and see that these patients were on the required medication, which would make them eligible for the service. The patient would then be called into the consultation room. The pharmacist would undertake a medicines use review using a national pharmacy database called Pharm Outcomes.
We picked out patients that might have been on high blood pressure medicines or diabetes medicines. We were also able to pick out patients who were over 65 and identify them easily. We used markers on their prescriptions to identify them, so we can ask for a screen when they popped in.
And they said to me, given what you're on, would you like to put your little thumb or finger on our machine? Don't have to, but it might tell us something useful that the medication suggests you could have a certain condition.
So to allow us to identify atrial fibrillation patients in the community, we needed to use a device which was easy to use, it was low cost and it was portable. The Kardia device allows the community pharmacist to check whether the patient is in normal rhythm or whether they're in atrial fibrillation, and this can be done in seconds.
If possible AF was detected on the Kardia ECG, then there would be an automatic referral to Harefield Hospital. The patient would be called into clinic by one of the members of the arrhythmia care team. At clinic, we would verify diagnosis using a 12-lead ECG. If this ECG confirmed AF, then we would talk to the patient about the different treatment options available to them, including anticoagulation, and come to a shared decision about that.
The key thing we're trying to avoid is to prevent you from finding out you have atrial fibrillation for the first time when you have a stroke. We want to prevent the stroke from happening in the first place, because we know stroke has devastating consequences for the patient, the family, and for society at large. If you ask people, are you afraid of death? Often they say no. What they're most frightened of is being disabled and dependent. And if we can do anything to reduce the risk of that, then it's well worthwhile.
The Capture AF service has been a real success. We've identified patients in the community who would never have known that they had atrial fibrillation.
There was a real potential for me to have stroke, and that I do not want if I can help it.